Hello. Okay, we will go ahead and get started. I hope everyone is doing well on this Thursday afternoon. I just want to start with kind of a status update, which of course we are still updating numbers every day around 4 o'clock on the website and on Facebook. So you know that we're continuing to increase. We will be at 195 at 4 o'clock, so that's one more from yesterday. 19 cases are active currently, and 3 of those are Department of Corrections. I want to talk a little bit about the difference in what you see in numbers on DOC's website and then our website or Facebook. So there's a couple of things. The total number is different because some employees that they have counted are people that we cannot count because they do not live in our jurisdiction. So our total number for DOC, that lighter blue circle that you see on that first graphic, is going to be lower than their total number. It's really not too far off because the majority of these cases are inmates, and those are our cases. But we do have a lower number than what DOC has for an overall number. DOC has also started reporting active cases. So here's some things to know about that. The way DOC is releasing from isolation is based on testing. So it's the testing strategy. There are different ways to release from isolation per CDC. So what they're doing is everyone who tests positive has to have 2 serial negative tests to be released from isolation. For us, we are basing that on the symptom-based approach because we need to have an accurate picture as to who's really infectious. And tests are taking weeks to come back. And so that's how we are doing that in the community, and that's how we will do that across the board for all of our cases. So what that means is for asymptomatic cases, which by and large, DOC cases are asymptomatic per the reports that we've received, that means it's 10 days out from test date for when they are released. So it is confusing, I agree, but that's the difference in the active numbers from what they have reported to what we have reported, because they're being a little more strict in how they're going to release those folks from isolation, and that applies to their employees as well. Bonterra, I want to just on the DOC discussion, ERDCC in Bonterra is finished with testing. The prisons in general across Missouri, once they've done their sentinel testing, so the entire facility is tested, they will be doing periodic testing that will test a randomized 10% of their population. So they're still going to be doing some surveillance testing going forward, which will be really helpful for us. And then FCC is almost complete with their testing. The labs are getting really bogged down again, and so it's taking a long time to get those tests back. So they're trying to send those not all out in one batch and do them in sections. That being said, because there are 2 outbreaks, there's an outbreak in Bonterra and an outbreak at FCC, how we treat outbreaks in general, so with other communicable diseases, we do not close that outbreak until it's been 2 full incubation periods since the last case was found. So that means it's going to have to be 28 days since the last case tests positive before we will close those out as a completed outbreak. So that's something that could be ongoing as we continue to monitor what's happening in the prison system. Switching gears a little bit to the community. So in the last a little bit over a week, we've seen almost a double in cases reporting that they have no known source of infection. What that means is we are probably seeing a low level of community transmission at this point. That is similar to what we're seeing regionally as well. We know that Jefferson County got several cases over late last week and through the weekend and are continuing to increase. And then St. Louis is also increasing in cases. And then also counties to our southeast and surrounding us are seeing increases. So again, we're going to talk a little about those interventions that we've talked about consistently, but we need to be really realistic as to what's happening, and we need to treat this as it's in the community because it is in the community. We will receive a breakdown from the testing event that happened at MAC, and I just want to say a really quick, thank you. I know we talked about it said it on the Facebook, but we really appreciate MAC allowing the National Guard to host that testing event, and the Missouri Department of Health for funding it and helping to organize it. That's a really great resource. Not all of the people tested were St. Francis County residents. We do not yet know how many because that registration was done through the state, but we will have a breakdown of that. So that will be helpful to know. And we haven't started receiving results from that, but we should very soon. Just kind of going back to cases in general, Missouri also is increasing. They have hit their record high 3 times in the last 8 days as of yesterday. So, we're seeing some increased transmission. And again, we need to be very, very vigilant and treat this like it's here because it is. And what that really means is social distancing, wearing masks, and washing our hands. There's very little resources or levers that we can pull in controlling the spread of this disease. And there's no one agency, there's no one person that can do this. We have to do this together. And again, that really means working together to control the spread. It's up to every one of us to help control this and protect the people around us. We've talked about it a lot, but when I wear a mask, and you can see my mask right here, I'm in an office alone, so I don't have it on, but if I go out into the health department, I have it on. Wearing a mask protects other people from me, and when they wear a mask, they are protecting me. And so, we have to be really considerate of others, and we know that there's lots of people who are susceptible in the community to severe disease, and we want to protect our most vulnerable. So we really have to act now to prevent this from spreading further and becoming to a point where we're seeing widespread community transmission. We don't want to see that happen because what that's going to lead to is more hospitalizations and could lead to more deaths, and we don't want to see that. We have had 10 people hospitalized to date out of our total, what will be at 4 o'clock, 195 cases. And we want to prevent that as much as we can. And, again, the way is to keep 6 feet away from people who aren't in our household, wear a mask in public places, especially where social distancing is not able to be maintained, and washing our hands, and of course, staying home when we are sick. I'm going to try to go back through here and answer some questions. There's not a ton that are coming in here. Your recommendation on obtaining a test to see if a person had COVID but did not know it. Oh, okay. So maybe you're asking about antibody tests. Antibody tests are to be used for public health surveillance, not diagnostic type of use. So someone who believes that they're actively infectious, but that's something you could do. Now, I would suggest doing some research or talking with your physician about what kind of machine they're using or test they're using, because some of the ones that we've seen and we've researched, they also test, those antibodies can be positive for other coronaviruses, so not SARS-CoV-2. So you want to make sure that you're getting an accurate test. I'm just trying to scroll through here. Again, the testing results should start coming in soon. The state said in a couple of days. So we're hoping to see those, sometime tomorrow or in the next few days. And again, we follow up on cases as they come in within 24 hours of receipt of a positive, and contact tracing within 48 hours. Will there be another testing event? It doesn't sound like that's going to be a regular occurrence as of now. They're pretty much treating testing events as going to hotspots of sorts. And I saw somebody ask a question as to how that came about. And really what happened was when DOC cases surged, it put us on the map. We were in the top 10 counties for a few days. And so the state reached out to me and asked if that's something we would want, even though they knew that a lot of those cases were DOC and by and large offenders. And I said, absolutely, because we know we've heard from the community and that they wanted something like that. And so that's really how that came about. It's not to say there won't ever be another testing event. It's just that there's nothing regularly scheduled at this point. Now, the health center wants to test eventually, but we have to have the capacity to do that. And right now we are very, very overwhelmed with investigations, and we're working on hire some folks under CARES Act funding, which we have not received yet, but we are applying for. Trying to get through here. How is the flu season going to play out this year? Will a person with flu be labeled as COVID-19? Inquiring minds want to know. As far as playing out in the way of numbers or distribution or prevalence of disease, that's will remain to be seen. Certainly the methods that we take to prevent COVID-19 definitely will help prevent the flu, but we're going to see flu just like we do every year. As far as will a person with flu be labeled as COVID-19, only people who test positive for SARS-CoV-2, the virus that causes COVID-19, will be labeled as COVID-19. So flu is reported differently. We do not investigate flu. Now, we might investigate flu outbreaks in a certain facility. But when flu comes to us right now, it comes as what we call aggregate reporting. And so it's numbers, and it's broken down by age category and the type of flu. And whereas COVID-19, we are actually conducting full investigations to determine the source of infection and then do the contact tracing and symptoms and all of those things. So it's quite a bit different, but you have to test positive for the flu to be counted as flu, and you have to test positive for COVID-19 to be counted as COVID-19. The caveat to that is, when we do an epi infection or an epi investigation, I'm just looking at my time here. If I'm positive, for example, and we do an epi investigation and my husband is also very symptomatic, we're going to refer for testing, but the likelihood is that he also has that infection. And so you see the breakdown there on the spreadsheet that's now the last picture when we post. It says epi linked cases or epi identified with epi investigation. That's what that category is. So, but we like to have the testing, but sometimes that's not always the best. How are the hospitals? Locally, our hospital capacity is good currently. So that's a good thing. I know that, again, the hospitals in St. Louis are starting to see an increase. If you follow St. Louis Coronavirus Task Force, you can find out a lot of information about what's happening in the St. Louis area as well. And that's important to know because we know a lot of folks seek care there as well. Trying to scroll through here. I just have a couple more minutes. Any news on, there's a couple questions about schools. So we're working with the schools. We've been working with them over the past several months, and lots of conversations, lots of planning happening right now for what the reopening of school looks like. At this point, it looks like that schools will open. Again, there's lots of changes happening. There's been a lot of changes over the last week with Missouri numbers, St. Louis numbers, and even our numbers. And so I don't think anything is going to be written in stone, but at this point, the schools are planning as if they're going to open, and then they also, have a lot of plans for what it looks like for virtual learning or blended learning, and so they can pivot because we know that things are going to look different going back into the school year. somebody says, a friend who works at FCC was tested 3 weeks ago and no one will tell her anything. She needs to maybe reach out to the lab or, the prison, or talk with HR or something. I don't know what the situation is there. If someone's positive, we get that result from the lab and then we contact them. So she would need to, or he or she, she said her, they would need to follow up with the prison. So just trying to scroll through here. I'm trying to make sure I get everybody. There's just some conversations between people. Okay, somebody is asking about inconclusive test. I'm trying to get back here. I have some friends who have got test results back that said inconclusive. What does that mean? And they had to retake it. So it literally means that it didn't give a good picture, it probably wasn't a good sample potentially as to whether or not it's positive or negative. And so we always refer those for a retesting. Really, they should treat it as being positive before, in the meantime of being retested, just in case it is positive. But we've also seen inconclusives come back as negative on the retest. So it's just, it's an inconclusive result and doesn't give a good picture whether it's positive or negative. What percentage of the health department's time is spent on contact tracing? So there's a couple of things to know here. Contact tracing, we do this for other communicable diseases as well. So it's something that we do all of the time. To kind of break this down a little bit better, maybe, we have one communicable disease nurse normally. Outside of our response currently, we have one communicable disease nurse for 66,000 people. Public health in Missouri is very poorly funded. It's the worst funded state per capita in the United States. So the resources are really, really limited. Right now, to do coronavirus investigations and contact tracing, it is taking 4 nurses to do that work. That's just strictly the investigations and the contact tracing, and then also they're doing our other communicable disease investigations. But they are very overloaded at this time, and we are hiring public health nurses. Okay, I think I missed somebody. I'm going to try to go ahead and get to them, even though I'm over here. Should FCC tell workers when they are negative? They only inform if positive, and I know it's causing confusion. My suggestion would be, and again, I don't want to speak out against what's exactly happening because FCC we're partners with them, but the best way to do that is to let people know whether positive or negative. I don't know if they have said we're only going to tell you if you're positive, if that's been a communication in the employees. For the health department's purposes, we contact people who are positive, not negative. So I think it would be important, and I can talk with them and send them an email just to clarify that, because I understand that people are concerned and they want to know the results, and again, just to give my recommendation. Who enforces mask mandates and social distancing at places like restaurants and bars? There are no mask mandates in St. Francis County, and then there's not a social distancing mandate in St. Francis County. Again, it really comes back to personal responsibility for everyone to follow the recommendations that have been given to prevent this from getting worse. Again, it's important to know we're in mitigation, and so we're trying to slow the spread as much as possible. And so, again, there's no mandates that meet any one of those interventions that you mentioned in our county currently. Ooh, I really have to get off here. I'm sorry. I want to answer questions. Do you see another shutdown in future weeks? I really hope not. I don't think anybody wants to go backwards. We want to keep going forwards. But to do that, we are all going to have to work together. Wearing masks, social distancing, washing our hands, staying home when we're sick. Those are the only levers we have to pull at this point. We don't have a vaccine. We don't have a viable treatment. We really need to work together to prevent that. I don't want to see that. No one wants to see us go backwards. We want to keep moving forward and help to protect people. I think there's only just a couple more things. I see one more question. I'm going to answer it and then I'm going to hop off. Will all schools be open as they've been preparing? Will any be online? Could they make it an option? From what I've talked about with others, with all of the schools, or talked about some through email, some via phone, some in person, working on committees, some to be working on committees. All of them are planning as if they're going to be open, but they're also having options for virtual learning or blended learning. It's important to know that, you guys know the quarantine period for this is 14 days. That's a substantial amount of time. And again, setting the stage appropriately, we're going to have cases in that age group, and we're seeing more cases in that age group across the country. So we're going to have to prepare for the potential for virtual learning or blended learning, whether in person and some blended with virtual. And so they're planning for both. I want to make sure I'm answering this question all the way. I'm just scrolling back up. I don't know that any will be exclusively online, but I think again there's going to be some options. My suggestion has been to them, and we've had lots of conversations, that there's again an option. Not everybody is going to feel comfortable going back to school, even with a lot of changes happening in the school, to make it as safe as possible, but remembering that you can't take the risk to zero. And so it's going to look quite a bit different. And I would encourage everybody, if keep up with your school, you probably have like a school email or something. I live in Farmington, so we got an email from Farmington. Keep up with your school as to what's happening. You can reach out to them. They're very busy planning for these things, but make sure you're staying up to date with what's happening with your schools for your kiddos. Will Walmart enforce masks starting Monday? I've read that the health department is not involved with that. That's a Walmart policy. So I would ask that, you guys reach out to Walmart to discuss their policies. Oh, okay. I see some questions about schools, but I really need to hop off here, and I've been kind of discussing that here and there. Okay, I'm going to go ahead and hop off. I'm sorry I've stayed on, 10 minutes longer than usual, and I know it kind of gets maybe redundant after a while, but I appreciate you all being on. Thank you. I know you're tired. Nobody wants to be having this type of response at this time and having to think about these things, but it's a serious thing, and we know that many people have died in the United States from this disease, and we want to prevent that, and we want to protect our most vulnerable. So, I would just encourage you, if you have questions, don't wait until these lives. If you have something that you really want answered, please reach out to us. You can call us. You can send an email through the website. And again, I know you're tired. We're all tired, but we've got to keep doing, these preventative methods to slow the spread in the community and protect our most vulnerable. So, I wear a mask when I'm out in public, where social distancing isn't possible, especially indoor areas. I don't like to wear the mask, but it's necessary, it is a pain, but it's a small price to pay to potentially save someone's life or prevent somebody from being in the hospital, in the ICU. We want to prevent those things. So we appreciate you. Again, reach out to us if you have any questions. Thanks.